Thank you, Les Concurla. I wish to voice my support for the amendment proposed by Deputy Howland. I think we have to ask at this stage, is this really about the risk posed by pubs and bars, or is this really about moral opprobrium? Is this about saying that we don't approve of certain behaviour? Because increasingly it seems to me to be about the latter. Along with, I think, the entire House, I voted to give draconian and emergency powers to the Minister for Health back in March. I don't regret doing that in any way, but I will not be voting to increase those powers at the end of November. I see no evidence to support their necessity from the end of November. And this legislation, it seems to me, is based on a presumption that those powers will roll over and that there will be a new normal, and that a new normal is somehow necessary. Now, I don't accept that, because I don't accept that COVID-19 is the first serious virus that this state has faced, or that it's the first virus that has affected this country. I'm not a COVID denier, not for a minute. I accept this is a very serious virus. I accept that it has very serious repercussions for people who contract it, and it has particularly serious repercussions for certain groups of people who should not be differentiated in any way from everybody else. But equally, as I accept that, I also accept the necessity for society to breathe, for people to live, for people to make informed decisions. At the start of the AIDS epidemic in the United States, public health doctors advised gay men, because it was seen initially as a disease of gay men, to avoid sexual contact with each other. And they didn't do that. And, you know, I read a very interesting study relatively recently from a Harvard professor who said that what we need to do, and the lesson from that, is not to prescribe behaviour, but rather to inform people of the risks of various types of activity and let people make an informed decision. Because that is what we do day in, day out in every facet of society and in every facet of our lives. And that is what we will have to do in this instance too. Yes, we had a lockdown. Frankly, we had a lockdown when we didn't know what else we could do to stop our hospitals and our healthcare system being overrun. Since then, thankfully, we have increased the capacity of our healthcare system, perhaps not as much as I would have liked, but we have managed to increase our capacity. But also we've learned a lot about the virus. I think no public health doctor in Ireland would now countermand a direction to protect nursing homes. But that happened. And it happened. I'm not apportioning blame. I'm saying we know more now than we knew then. So to return to this particular amendment talks about a direction or otherwise. So is this really about increasing Garda powers to inspect bars? Because actually we don't approve of bars. And you know, there are lots of people in society who don't approve of bars. Lots of them. And guess what? None of them are forced to go into a bar. There are lots of people in society who disapprove of smoking. Nobody is forced to smoke. But at the same time, we don't stop the sale. If we're seriously going to go down this road, well, let's question, do we want to stop the sale of alcohol? Do we want to have a prohibition era in this country? Because it seems to me there are people who want to do that. And this latest direction from NEFIT, that we look at concerts, but not concerts where alcohol is sold. Now, that seems to me to be very clearly going down a road saying, we don't want alcohol, but, you know, you can have a mosh pit at the front of a Megadeth concert or something like that, and that's fine, just as long as, God forbid, somebody should have some alcohol at the concert. I mean, it is ridiculous and bordering on slightly irrational, if I may say so. But I understand why NPHET are coming up with these directions. I mean, if you ask any doctor and you tell them that we're going to put you in a situation where you're calling the shots and we're going to hide behind you, well, of course they're going to be incredibly conservative. Of course they are. Who's going to want to take the blame for getting it wrong? Nobody is. And certainly no politician is, which is why we have set up this bizarre structure in Ireland that we're essentially sending out a group of unelected officials who are working incredibly hard with the intention of keeping us all safe, but nevertheless we're sending them out to do a job which people are elected to do, paid to do, and have a seal of office that they collected in Áras an Uachtaráin to do. And it has to end at some point. So using COVID to grant extra powers to An Garda Síochána that are not about COVID is something which seems to me to be reprehensible and wrong, and I support the removal of the provision enabling that from this bill, which is before the Dáil.
Thank you.
Therefore, I support Deputy Howland's amendment.
Thank you.